and Ralph is going to come up to the microphone and speak to us about this study. Thank you and welcome.
Do you have the presentation? Is that the deck? No, that's the report. So thank you very much, Your Worship and members of council. Really pleased to be here on a beautiful sunny Monday. It's Monday. It was a busy weekend. So I'm managing director of our advisory and sustainability services. I manage a team of real estate advisors across Western Canada for Colliers Project Leaders. I'm very happy to be here this morning and present the findings from our needs analysis and feasibility study for a community health center for the town. We've been working on this for a number of months. This is going to be a very high-level presentation to you, but I encourage you to ask as many questions as possible. If you want to interrupt me in the middle of the presentation, please do. I'd rather I provide you as much detail and much information as I possibly can. I believe Barry has provided you with a copy of the report as well as the presentation itself. Mm-hmm. All right? All right. Could you do that in full screen? Is that possible?
Because it's going to get, because it's
See
not.
See that little button right there? Yeah, try that. There we go. Awesome. Okay, so our study was essentially two different parts. One is we really wanted to understand what were the needs of the community from a healthcare perspective. And then second of all is how does that translate into a community health center, and what does that really look like from a feasibility perspective? So those are the two basic questions that we were asked by the town to answer. We had a steering committee meeting a few weeks ago where we discussed the results of our draft report, which is subsequently revised, and so you have a copy of the revised report. The next slide shows a little bit more of the detail of the steps that we've gone through. Nope. Perfect. So we of course gathered information about the community, about the demographics in the community. We analyzed information from Interior Health on visits to physicians, visits to the hospital in Oliver, and we looked at what kind of services are currently being provided in the community. We then went out to do a bit of a market analysis. We looked at if we were going to build a community health center, where would we possibly build it? So our market analysis is really about identifying sites where we could actually locate a community health center. And then we went through a qualitative options analysis around those sites, followed by a quantitative analysis about the feasibility of actually building, constructing, and operating a community health center in the region. And then we developed a set of preferred options. And you'll see at the end of the presentation, we think there are three possible options for the community to bring a community health center here to this area. There we go. All right, so our source information came from, as I mentioned, demographic information. It came from Interior Health. They have a health utilization system which we accessed information. We looked at current services that were being provided in the region. We held a community consultation a few months ago where we invited members of the community to give their feedback and engage them on what they felt was really important for them. And then we held stakeholder focus groups. So we brought different agencies together. We brought physicians, we brought Interior Health, we brought some mental health services and other groups together to look at, okay, what combined are they expecting and what would be a successful solution for the community. We then identified that what is called an urgent primary care center is what would be an ideal solution for the community. And I'll describe a bit later about what that actually means for the community. But once we had defined what that ideal solution would be to meet the current needs of the community in terms of a health perspective, that gave us a sense of, well, how big could that actually be? And so we needed the space information to be able to run a feasibility analysis to look at what would it cost to build a center and what would it cost to operate. All right, yeah, excellent. One of the key things that we found when we began our health needs assessment was that there are a proportionally large number of visits to the emergency room at the hospital in Oliver. These are the 5 different classifications of the types of visits. The 4 and 5 categories here are the ones where somebody has a sore throat, somebody has a deep laceration, they need some stitches. It's those kind of daily kind of walk-in things you would otherwise go to a walk-in clinic. People are going to the emergency room for those things. And when we looked at what was going on at the hospital in Oliver and we compared it to the other interior health hospitals that they manage, that hospital has a disproportionately large number of these category 4 and 5 visits. About 60% more than any other interior health region. And what that tells us after we actually met with interior health is that the reason that's occurring is because we don't have an urgent primary care or a walk-in clinic to take some of these visits off of that hospital load. And so this is the area where we felt this would be the ideal solution for the community, is something to take the load off of the particular hospital. All right, Brianna. So this is what an urgent primary care center really looks like. For this particular community, we identified that we would need approximately 8 physicians would be an ideal model. Based on input that we actually obtained from our steering committee a couple of weeks ago, where one of the members had actually already done a feasibility study in a different jurisdiction, they had run models and they said 8 physicians is kind of the ideal business model for when physicians come together. Any more, it becomes more costly to operate, and any less number of physicians also becomes more costly to operate. And so we identified that there would be 8 physicians, a nurse practitioner, and we would also provide some mental health services within the overall center. The emphasis would be on urgent primary care, but also on aspects of prevention and chronic disease management. And the reason why those are there is because of the aging population and the large demographic that you have that are in the older years, is to focus on chronic disease management. We also identified that it would be ideal if there was some diagnostic imaging services provided in the center, as well as a small laboratory. And now that is, of course,
Excuse me, Ralph. Yeah. CJ had a question.
Go ahead.
Could you give me a little bit of information on what a mental health clinician is, and how they're qualified, or what training they've had? Or?
So that would be somebody who would be able to help individuals with mental health problems that come into the clinic, and perhaps physicians might be able to identify those kind of illnesses in their screening, and they might be able to bring such a clinician into visit them. I can't be specific about what kind of qualifications that would entail, but I can get back to you in terms of what that actually means in terms of accreditation and levels of certification.
Thanks.
Yeah. The other point that was discussed in our past steering committee was that there is a sense from the physicians that we spoke to that a social work dimension might also be of interest. But these are the top areas that we identified in a healthcare needs assessment. Now, I have to be clear that this is not emergency care. So this is not if you have a life-threatening injury or you have a heart attack that you would be going to this particular center. You would be going directly to the hospital. Okay? So once we identified that the urgent primary care center would be the ideal model for the community, we then said, okay, how does that translate into a physical building? And one of the first things that we have to do, of course, we have to estimate how big that's going to be. And so based on the profile that you just saw, there are two options for the physical assets required to provide those services. One is that you can lease space, and the other one is you can build space. And so that's why there's two different numbers shown here, is that if you leased space, it would be a smaller footprint, of course, but if you built it, your building is bigger. So we use these two particular figures to then inform our financial and our quantitative analysis from a feasibility perspective. Okay. So when we conducted our market analysis, we identified 5 possible sites for a location for a community health center in Osoyoos. We quickly discounted 2 of those sites. So this is market information that we obtained from our parent company, Colliers International. The one site that's on 89th Street and Nighthawk Drive, that sort of bridges between those two, we discounted that one because it is a very, the topography on that particular site has a high gradient. So there's quite a large height difference from the front of the site to the back of the site. And whenever you have that, you have a significant amount of additional investment for construction and parking and site access. So we said, okay, we know right away that's going to be significantly more expensive to build than any of the other sites. So we put that one off to the side. The second one was 6901 Main Street. Great site, a little bit closer into downtown. But there's 2 aspects to that site. We didn't feel that a community health center would be its highest and best use for that particular site. And the reason is that the market value of that particular site could actually be translated into probably an additional tax revenue if it was changed into a residential development. Okay, it's right by the water, really good access to the water, wonderful views if there was a building that was higher stories to overlook the other 2 buildings in front of it. So we thought, okay, from a town benefit perspective, something that's not on the water is probably what you want to do. You want to put something a little bit closer into downtown and not take up prime real estate close to the water, which is one of the reasons why Osoyoos is so attractive in the first place. So the other aspect that we discounted there is the risk of flood. In putting a urgent primary care right close to the water, we said let's not do that. So then we were left with 3 different possible sites to look at from building and constructing this facility. Yeah. The next level of analysis was down into, okay, we know that there are possibilities to build and own something. And then there's possibilities to lease space to provide these services to the community. So those are 2 ownership options that we looked at. And then we looked at the different site options. And so you'll see basically that we analyzed 6 different options or 6 different scenarios in our study. The first 2, actually the first 3, 1A, 1B, 2A, are all related to the current Sagebrush Lodge site. And I'll get into a little bit of the details. And then 3 and 4 are the Spartan Drive and the Maple Drive sites. So these are the different ownership and development options that we looked at in terms of running our financial feasibility. I'm not going to go into too much detail about the different scenarios, but essentially 1A and 1B is that the scenario would be that the town buys the land, demolishes the current lodge, and builds a completely new center, and that the town would then lease space to the operator of the primary care center, as well as to Interior Health. I should also just clarify that we were asked by the town to consider developing with this facility some residential units. We were originally asked to look at market rate housing in a way that could it be feasible to integrate market rate housing into the same facility so that the operating costs are overall reduced. So each of these options includes a residential development of 12 units. I think it's 12 2- and 3-bedroom condominium units. So the second 1B is the option would be to take the sort of the triangular portion of that particular southern part of the Sagebrush Lodge site and develop a community health center and residential on that little corner. We know that we need about 0.7 acres to do this entire site, so that development easily fits into that little triangle. Scenarios 2A and 2B are around partial demolition of Sagebrush Lodge. Either the town buys the site or works together with Interior Health, and then we would build a clinic and a residential development and close to adjacent to the existing building, but there would be a demolition involved in those. Okay. And then 3 is that the town would buy the land at Spartan Drive and take down the house, again, develop a brand new clinic. And 4 is the town owns that particular land and you develop a clinic there as well, brand new clinic with residential units. So those, at a high level, those are the details of the different scenarios that we analyzed. This is essentially our methodology on how we did that analysis. I don't think I need to go into the details of that methodology, but our overall calculations on feasibility used existing costing information that is produced by Altus and in consultation with our real estate group, as well as experience with past projects in the region. And then, of course, we look at the aspects of the capital cost, we look at the operating cost, and develop a quantitative net present value calculation. Together with that, we also looked at a qualitative analysis around the different site options. So this is an overview of the qualitative results. The red, yellow, green is about where each of the different development options and development scenarios scored well or medium or poorly. I don't want to bore you with all the details of the calculations that went into this particular qualitative analysis, but we then married those with the quantitative analysis. So from a quantitative perspective, there are 2 particular options which would be most attractive to the town itself. One is that developing a new urgent primary care on that triangle of land to the southern part of Sagebrush Lodge, and then a partial demolition of Sagebrush Lodge and rebuilding a clinic and putting a residential development. Those are the 2 from a net present value perspective seem to be the most attractive to the town. I would say though that the aspect of developing on Maple Drive and owning that one is a close third. So if the town wanted to attract physicians into a site that's a little bit closer to downtown and is willing to understand the premium associated with that building, then that might be another option to look at and to consider for the long term for building the center. When we combine the qualitative with the quantitative score, the 2 options as well that we identified in our quantitative analysis also turn out to be the most attractive. Again, with a close third with Maple Drive. And so the other ones where we're taking down Sagebrush Lodge completely or doing a partial demolition are not as attractive, primarily because of the cost associated with the upfront capital. Anytime where you're doing and you're building in a demolition into your project, that's usually adding additional cost, even though you think intuitively, oh, I might be able to save materials, but in the end, it is more costly to take things down and rebuild new. All right, so I think generally I've summarized the sort of the key highlights and the potential options for the town to consider. I think one of the key things that has come out from our work is that regardless of which particular path the town wants to take, the aspect of what's attractive to the town has to be balanced with what's attractive to the physicians and the clinicians and the members of the healthcare community who want to come and work there. So bring that group together, and bringing a group of 8 physicians together is not an easy and not a particularly easy task, but it has to be made attractive to them. So we all know that doctors run a business, and so this is partially a business decision for them to say, okay, are the benefits that I'm going to receive from this co-location and coming together as a group, are those going to be balanced with the cost that I have to pay to be there? All right, so Brianna, can you move to the next slide? We also looked at a very high level of how there are possible ways to fund this particular center. And originally we were asked to look at market rate housing and we identified that 12 units would be an ideal number to include in this development. The aspect of that is that we would then have to attract a developer to help us. And of course, whenever we are going to do that, that's going to add costs, which you have to then translate to likely higher rental rates or lease rates to the physicians. And so the aspect of that higher capital cost may not be attractive to the town. We do know from our consultations with Interior Health that they are amenable to working with the town and the physicians about what can be done at the Sagebrush Lodge site. In our consultations with them, they said, yeah, there might be opportunities to renovate or partially upgrade or build on that particular site. So subsequent conversations need to be had with Interior Health to explore the possibilities of what can be done on that particular site. And that you might find that through those consultations that it changes the financial outlook of the capital required to develop on that particular site. I would also say that that there is potential, given the national housing strategy and the emphasis in British Columbia on affordable social and seniors housing, that there may be synergies of looking at, is there a possibility to shift from a thinking of making this market rate housing to making it housing that fits within the national housing strategy, where we know that BC Housing and CMHC are interested in funding projects of that particular type. We also know that Interior Health has promised to deliver 12 urgent primary care facilities and centers across the province. But from a regional perspective, we also know that there's a particular process that you have to go through to do market studies and justify the need for those. Our understanding is that this region falls in a rural sort of classification from Interior Health. How we actually are able to do and steer that path with Interior Health and to explore the possibilities of getting and accessing that funding for an urgent primary care facility here from Interior Health, I think there's opportunities to explore that as well. And so I think we've come to the conclusion that yes, Osoyoos needs a primary care center in the region. There are different options with respect to how to fund that, but there's interest from Interior Health to continue to explore that, and likely some areas of exploration related to social seniors or affordable housing that could come together with a very unique facility that blends healthcare with a broader social agenda. So that's...
Thank you very much, Ralph. I really appreciate, and I'll let ask for questions from council in just a sec. I just want to say thank you for going through the process of looking at everything that I believe that was asked for. For people in the audience, there are reports on the back chair there. If you would like one, you're welcome to take one, okay? I didn't know whether anybody had picked those up on their way in. So now I'm sure that there will be some questions from council, so I'll certainly open it up. And if there is something from any of staff or the audience, we would let that happen after council. Okay, thank you. Councillor Campbell.
Thank you, Member Kordoff. Another example of frustration with when you hear about the extreme anomalies of the numbers and from the South Okanagan General Hospital to see that municipality had to take the lead and find funding for a study that, in my mind, should have been done by Interior Health with the challenges we're experiencing. But that's not my question. I have two. And thank you for the report. Looking at the staffing levels that have been suggested for a facility like this, I guess I'm trying to understand when for the past several years we haven't been able to staff the emergency room with local physicians through Oliver and Osoyoos, to the point that we've had to close that emergency room at some of the most crucial times on weekends and long weekends. So my first question is, how much consideration was taken into the challenges with recruitment and staffing for medical needs here? My second question is, I'd like to understand what due diligence was done as far as understanding the needs of the communities in terms of mental health, and even more specifically youth and child mental health when we look at the position that was suggested here for mental health.
Okay, so I think the first one is around staffing levels. So we have a section on the report that deals with what are our possible recruitment strategies for bringing physicians into the community. From our current work with the steering committee, we identified that there were 2 net new or possibly 3 net new physicians coming into the community recently in the last 6 to 8 months, which is a very positive sign. We do see that there will likely be physicians in the community who will be attracted to coming and working in the center. So these 8 physicians would not necessarily be net new, but they would be a complement or probably a mix between net new and existing that are already working in the region. And so the aspect of making it attractive to come here is one of the reasons why we also looked at the residential development. And we could see a possibility of certain portions of that residential development being earmarked or set aside. If the town was to develop a center on their own, would earmark to the side to say, we've got 2 or 3 units set aside to help physicians into the transition of coming to this community, and perhaps at a discounted rate. I don't think we actually looked at modeling that particular discount into our financial analysis, because we wanted to be, let's say we wanted to be conservative and not base our net present value on something which is a possible or a hopeful. Okay, so when we do these analysis, we always try to be fairly conservative. With respect to the details of the scan of the mental health requirements in the region, we didn't get down to, let's say, that granular level of detail. But when I mentioned earlier about our discussions with the steering committee of balancing that need with respect to perhaps there's a social worker need as well, is that I think at least in that initial form that indicates that there's an opportunity to do a little bit more digging before we finalize what that would really look like. And really, is there a switch out, or do we have to provide both, or just one, right? And then what do they actually provide?
On your first answer regarding the staffing levels, is there a concern there that we're sort of robbing Peter to pay Paul if with the physicians not being able to, if they were attracted to work in this facility, that we'd have more vacancy in the emergency room? Yeah,
so there has been discussion with the steering committee about that and the challenge around balancing it. I think that, from our view is you're just rebalancing the load from one location to another location, right? And some would say, well, then you're going to, you're going to decimate the hospital. But no, there's other hospitals that work on that particular level that meet the needs of the community, but there's a reshifting of the workload and, of course, the positions and the physician services into a different area. And so you would likely see generally a net balance occurring that. If not, you would probably see an increase in the number of physicians in this area. So that's generally what we see.
Thank you.
I was just going to mention, too, that one of the reasons why we started this whole process a year ago was that we had some of the residents in town come and say they couldn't find a primary care doctor, and could we look at doing something about it. We do have 7 doctors in town right now, which is good, and there's an 8th one coming this fall. So that is positive, and I know that several people have commented that they have been able to find a primary care doctor. So that was sort of one of the reasons for even looking at this whole study to begin with. I should also say that the provincial government is looking at, and we had Susan Brown here on this committee, who's a member of Interior Health, and I've forgotten her long title, but primary care networks, and that's something that is being certainly piloted in the South Okanagan, primarily at this point between Penticton and Summerland, but we have pointed out that we absolutely need to be included in that as well, and they are working on that, and Susan was listening and understands, and she listened to the whole presentation. So I see that as a positive, and so we're quite encouraged that things we think are starting to be a little bit more proactive.
Yeah.
I'm going to open it up to Councillor Rhodes.
Thank you again, Member Kornoff. I wonder if you could elaborate on your positive comments about Interior Health and the Sagebrush Lodge facility, which is one of the primary components of your report. You sounded quite positive about it. That might be a little bit different than some of the experiences that we've had over the last little while with, not necessarily with Interior Health, but with that particular building.
Right.
I wonder if you could just elaborate a little bit on that.
So we because we developed our scenarios, we immediately wanted to find out, okay, well, we're not going to explore demolition or renovation or taking over part of their site unless we have a conversation with Interior Health. And so we went to their real estate group, and they were open to discussions about the possible, because from a real estate management perspective, they're always looking at trying to find ways to optimize the use of their assets, right? And or possibly reduce costs or improve efficiencies. They were hesitant about making a commitment, which you can understand. There's partially at this stage, it is good to explore, but not necessarily commit to a particular solution. So our sense was that they were positive in terms of the openness to explore what is the possible at the Sagebrush Lodge site. Whether it is the building of something new in that corner, or whether it is a renovation or a demolition of the site, they would explore further conversations around that. So, in other words, we were positive because they didn't say, no, that's off the table, we don't want to touch it, we're not interested. So, and I generally think real estate individuals and managers are always trying to find ways to reduce their costs, but also enhance their portfolio. So I think this is a worthwhile conversation to have with them. Yeah.
Thanks.
Anybody else? Mr. Emenko.
Thank you. Thanks, Ralph. A really good report. Certainly when we started this process, what we were looking for was a kind of a foundation document that would allow the community to make a total assessment and of the situation, and I'm pretty sure that your company has provided that to us. So thank you very much. One of the things you mentioned, you had a number of options, but for the benefit of the viewing public, could you just go back to them and just identify some of the costs that are specific to those options, because we talked about options and you had costing up there, and I think it's important that the people viewing know that there's the cost attributed to the options.
Sure. Brianne, can you move up to, I think that was the quantitative analysis, right, Barry, that you were referring to? Keep going. There we go, that one. Okay, so a little difficult to see on the screen, but you can see. Okay, so I think there's two aspects that we really want to focus on here. Not necessarily the net present value, although the smaller the number in net present value, the better this would be for the overall town. So first thing is we're looking at this from the town's perspective. We're not looking at it from the physician's perspective. There's the second column is the land acquisition costs, and the third column is the capital cost. So that is the overall construction, design and construction of the facility itself. All right, and so you can see that a 2B is very attractive from a capital cost perspective and from a land cost perspective, because it assumes that Interior Health is still going to own the land and the town is not going to buy it. So all the town is doing is building the facility. And so that's where that 4.5 million comes in terms of capital cost. If you look at number 4, where this is a site that's a little closer to town, right, a little bit more attractive, the capital cost goes up because it's not a renovation, it's a brand new facility. Okay, so it's a significant jump up from the lowest capital cost.
So that number, for the benefit of the people watching, is
9.8 million.
9.8 million.
Thank you.
9.8 million. So if you own the land and you just essentially wanted to build a community health center with 12 units of residential up above, you're looking at around 9.8 million generally. So in that particular ballpark, all right? And then the costs go up in the other scenarios primarily because of the aspect of demolition being involved or land acquisition costs, okay? And then the fourth column is about operating income. And of course there you're interested in maximizing your operating income. Although from a town's perspective, if this was run by perhaps a society, you would be looking at saying, oh, taking that net operating income or net profit and putting it somewhere else, or putting it back. And this also assumes ongoing investment in terms of operations and maintenance and repair and sustaining capital for this facility. So generally, you're looking at, if you own land and you built something brand new with residential on top, 12 units residential, you're looking at about 9 million. If you wanted to just build the center without the residential, you'd probably come up with a different number and probably substantially lower. Okay? Thank you.
Thank you very much. Mr. Manko, can I ask, is there, what would be, when we receive this report, what would be the next steps to, in terms of looking at this again?
Well, the next steps, this is a presentation by the consultant. The next steps is that we'll be bringing this report to council at the next meeting to look for a resolution for accepting this report for information as for future planning.
Okay.
And then my sense is it'll be on the table for the next council to take a look at how this study can be advanced or moved within the priorities of local government and the community.
And the budget?
Yeah.
Yeah, sure. Okay, thank you. I just think everybody needs to to realize that we're not going to start breaking ground on this morning. No, it'll be a while before we get to that stage after we discuss it. Okay, thank you very much. We appreciate you coming up again and talking to us about this. And thank you for the report. So that's it. Anybody else has anything? Good.
Is there any questions?
Was there a question?
I don't know.
I didn't see anybody indicate to me, so
Okay,
I
all right.
was okay. They could talk to you after if they wanted to anyway, I suppose, or come and contact us. So thank you very much. I
Thank you very
appreciate
much, Your Worship.
you coming to visit us again today.
You're welcome.
And I think that's the end of our committee of the whole meeting. So could we have a motion, please, to adjourn the meeting? Councillor King, Councillor Campbell, all in favor. Thank you. And we will take 5 minutes.